Filtrate is the cell-free and protein-free fluid that a healthy kidney will produce from blood plasma. It is produced at the glomerulus and captured by the glomerular capsule. Both kidneys will produce between 180 liters and 200 liters of filtrate during a typical day. This filtrate will ultimately be processed by the kidney tubules to produce less than 2 liters of urine per day. Filtrate is similar to blood plasma, except that it lacks blood cells, platelets, antibodies, and blood plasma proteins such as albumin. This is because all of these are too large to pass through the filtration membrane at the glomerulus and will remain in the bloodstream. Only the fluid from the blood plasma and the small dissolved substances within it will compose the filtrate. Filtrate contains water, of course, but it also contains glucose, amino acids, sodium, potassium, calcium, and other ions, in addition to vitamins and wastes. The wastes include nitrogen-containing wastes such as urea and uric acid. Many of the nutrients, electrolytes, and water that are in the filtrate will eventually be reclaimed by the structures in the renal tubule, such as the proximal convoluted tubule, the nephron loop, and the distal convoluted tubule, or will be reclaimed by the collecting duct, which is beyond the renal tubule. Urine is the processed filtrate where much of the water and the nutrients, glucose, and electrolytes have been removed. It is created when filtrate leaves the collecting ducts, as the collecting ducts represent the final place within the kidney where the kidney can modify the contents of the filtrate. The collecting ducts end at the renal papilla of the renal pyramids. Urine emerges from the papilla and is funneled towards the ureters by the minor calyx, the major calyces, and the renal pelvis. Unneeded waste, such as extra sodium, potassium, or water, along with normal metabolic waste, such as urea and uric acid, are secreted into the filtrate to be eliminated as urine. Previously, we have seen that the kidneys are capable of producing upwards of 200 liters of filtrate per day. From that filtrate, the kidney very efficiently processes it to create less than 2 liters, which is 2,000 milliliters of urine per day to be eliminated. The basic characteristics of urine are as follows. It should be a pale yellow color if well hydrated, or a deep yellow or amber color if dehydrated. Normal urine contains a yellow pigment called urochrome, which is a byproduct of the breakdown of hemoglobin proteins. It should be odorless or slightly aromatic when freshly voided. If it's left standing for extended periods of time, bacteria that are in the air will begin to metabolize the nitrogen-containing compounds within it and produce an ammonia smell as a result. Typical volumes produced should be between 750 milliliters and 2,000 milliliters per day. It should have a pH that widely varies between 4.5, which is quite acidic, to 8, which is quite alkaline. It can be acidic if the body is eliminating excess acids from the blood plasma or if the individual is diabetic and is not treating their diabetes, as some of the byproducts of the metabolism of diabetic individuals are acidic and the individual is suffering from a condition known as diabetic ketoacidosis. And this is a serious complication of diabetes mellitus. The specific gravity of urine should be in the range of 1.003 to 1.032. Specific gravity is a number that compares the mass of a volume of fluid containing solutes or dissolved substances to an equal volume of pure water. Pure water has a specific gravity of 1.000 as a baseline, and so urine will always be slightly higher than that because urine always contains at least some solutes, even when urine is very dilute. The specific gravity of urine should be low, around 1.003 if the individual is well hydrated, but it can be as high as 1.030 or 1.032 if the individual is dehydrated. Urine should not typically contain glucose, but glucose may be present if the individual has consumed a large amount of sugar in a short period of time, because when blood glucose rises quickly, the kidney tubules cannot recover all of it from the filtrate, and ultimately some of it will be lost to the urine. Glucose may be present in the urine if the individual has untreated diabetes mellitus. The term glycosuria refers to the presence of glucose in the urine. Urine should not contain any blood cells, but they might be present if the person has hypertension, that is high blood pressure, or has experienced physical trauma to the kidney. These both can cause damage to the filtration membranes within the glomerulus. Red blood cells may be present In the urine, if the kidney, the ureters, the urinary bladder, or the urethra have been damaged by kidney stones, the presence of red blood cells in the urine is known as hematuria. The urine should also lack proteins, as these are typically too large to pass through the filtration membrane in the glomerulus, but they might be present if the individual has hypertension or has suffered kidney trauma. Proteinuria is the term for the presence of proteins within the urine. Leukocytes are not normally present in the urine. However, they may be present if the person has a urinary tract infection or a kidney infection. Typically, along with leukocytes, the pH of urine will also be high, somewhere around 7 or 8, as bacterial metabolism from the infection will create an alkaline environment. Ketones may be present in the urine if the individual consumes a low carbohydrate diet or if they have diabetes mellitus. Ketones are byproducts created when the body metabolizes lipids in adipose tissue or metabolizes fats for ATP production. Glucose is normally metabolized to create ATP energy, but when it is absent or when it is unable to be metabolized as an energy source, such as in diabetes mellitus, the body will switch to other mechanisms, such as those that metabolize fats and lipids. The presence of ketones in the urine can cause the urine to smell fruity or like acetone and is referred to as ketonuria.